Children's health bill clears House as states struggle to keep programs afloat. Washington, the House passed a bill on Friday that would provide 5 years of funds for the popular children's health insurance program over vehement objections from Democrats who opposed the way it would be financed. The vote, 242 to 174, came a month after funds for the program expired. The Senate plans major surgery on the legislation to avoid the partisan strife that split the House. But some states may have no choice but to freeze enrollment or start to shut down the program before Congress clears legislation to renew funding. No new funds have been available since October 1. In the House, 15 Democrats joined 227 Republicans in voting for the measure on Friday. Only 3 Republicans voted against it. The bill would provide money for the Children's Health Insurance Program and clinics known as community health centers, which care for low and moderate-income people around the country. Both programs have enthusiastic support across the political spectrum. But lawmakers clashed over how to pay for them. To offset the cost, the House bill would increase premiums for Medicare beneficiaries with income of more than $500,000 a year, remove some lottery winners from the Medicaid rolls, and cut $6.35 billion over 10 years from a fund established by the Affordable Care Act to pay for public health initiatives such as preventing diabetes, heart disease, cancer, and opioid abuse. In addition, the bill would end insurance coverage for several 100,000 people who fail to pay their share of premiums for insurance purchased in marketplaces under the 2010 healthcare law. Most people who buy insurance through the Affordable Care Act marketplace receive subsidies to help pay their monthly premiums. Under the law, if they do not pay their share of premiums, insurers must give them a 3-month grace period before terminating their coverage. The House bill would reduce the grace period to 1 month, unless the state specified a different period. The Congressional Budget Office estimates that the government would save nearly $5 billion over a decade because fewer people would have government-subsidized coverage. Republicans said some people were abusing the longer grace period to skip out of their financial obligations. But Representative Diana DeJette, Democrat of Colorado, said nobody should have to lose coverage in order for others to keep it. Colorado is likely to run out of CHIP funding in January, with termination notices going out to worried families in the next few weeks, Ms. DeJette said. Yet here we are with a partisan bill that asks us to pay for low-income children's insurance on the backs of seniors and the most vulnerable. Republicans defended their path to pay for the children's health program, especially the higher Medicare premiums. It was reasonable to require wealthy people to help defray the cost of care for children from families of modest means, they said. When you are making $500,000 a year, you can pay a little bit more, said Representative Tom Cole, Republican of Oklahoma. Warren Buffett and Donald Trump don't need the same Medicare program that Ma and Pa Kettle living on Social Security do. Democrats, who often seek higher taxes on high-income people, denounced the proposal. I'm not worried about whether wealthy families can afford to pay increased Medicare premiums, said Representative Debbie Dingell, Democrat of Michigan. But I'm worried that these changes will result in wealthy people abandoning the program in large numbers, which would worsen the risk pool and ultimately increase the cost for middle and lower-income seniors. It would fracture the universal nature of Medicare and put the entire program at risk. AARP, the lobby for older Americans, strongly supports the children's insurance program, but tried to block the increase in Medicare premiums. Higher-income Medicare beneficiaries already pay more in monthly premiums, Nancy Lemond, an executive vice president of AARP, said in a letter to House members. In addition, she said, higher-income seniors have been paying more into the Medicare program throughout their working lives. But Representative Greg Walden, Republican of Oregon and the chief author of the bill, said, we are just asking the wealthiest seniors in America, those making $40,000 a month, not a year, a month, to pay about $135 a month more for their Medicare, so we can fund children's health insurance for 5 years. 5 states, Arizona, California, Minnesota, Oregon, and Washington have received emergency infusions of federal cash to prevent an interruption in coverage of children. But the amount of unused funds available for that purpose is far less than the expected need, and an independent commission that advises Congress warned this week that 29 states will exhaust all available federal funds by